Hello and welcome to another episode of Hematology Horizons. My name is Elissa Baldwin. I'm the Director of National Patient Education at the Leukemia and Lymphoma Society. Today we have a very special episode as we are taping on site at CancerCon in Austin, Texas. This is a conference put on by Stupid Cancer, and it is attended by hundreds of patients, survivors, caregivers, nonprofit and healthcare professionals. And it is here to provide support and education for the unique issues that young adults with cancer face. And today I am so excited to be joined by Dr. Sam Siegel, who is an internal medicine physician at Kaiser Permanente in San Francisco, and Donna Bell, who is a nurse practitioner at MD Anderson in Houston, Texas. And so thank you both for joining me. Now, this session is very special. We did our annual LLS session at CancerCon, and it was titled, "What's Next on the Roadmap of Cancer and Finding Primary Care," which is a huge topic. Now, Donna and Dr. Siegel were on the panel, and I was on the panel as well, sharing my personal experience with primary care leading into my cancer diagnosis as well as after. And so our first question for you both today is, why do each of you feel like transitioning to primary care can be difficult for patients?
So I think sometimes patients come from primary care at diagnosis with negative experiences, and so I think sometimes there's a lack of trust. That can be a barrier to transitioning back to primary care. And it's really not transitioning back, but incorporating primary care into their care now. Sometimes that's the issue. Sometimes it's just being overwhelmed with undergoing cancer treatment and seeing different specialists. And so, you know, unless somebody's addressing what primary care can add to their care, they just feel like it's just another appointment, and why would I add another appointment to my already busy schedule? So sometimes patients really need that education about, you know, what does primary care add to my medical needs?
Yeah. And why do you feel like this topic was so important to speak on?
At Kaiser San Francisco, I'm piloting this care model called PCP Onc Cares that is a longitudinal survivorship cancer care process that's supportive care in cancer during and help with recovery afterwards, and then monitoring patients for late and long-term effects. National Cancer Institute defines survivorship as anybody living after a cancer diagnosis through the balance of life, so for the rest of their life. And yet it's not delivered that way. And going through my own cancer care, I just saw this huge gap, and I experienced the gap. I didn't even know that there was a word for survivorship, a word for recovering from the toxicity of treatment, a word for a system that encompassed like a process for how to help you go on living. And so I think that it's really a story of empowerment, that there is another clinician that can work with your oncologist to help you live your best life during your diagnosis, you know, and after, if you are somebody who has an end of active treatment. I think we're trying to like reinvent this whole story and process where survivorship doesn't start at the end of treatment. It starts from the day of diagnosis, so that even metavivors or even people living with incurable cancer can get whole person care that pays attention to their entire life experience and all the organ systems and all the long-term needs for however long somebody's alive. So I'm really excited about that. I know that Donna is doing some of that already at MD Anderson, and big cancer centers have already been tuned in to these types of programs. And so now I think we're hoping to kind of recreate that and trickle down in the community setting as well, and not just have it limited to like big cancer centers or academic centers.
Now, why should a patient look for primary care? I mean, what is the real benefit of moving away from your oncologist and getting with somebody who is a primary care physician?
Like do you have glucose issues after your treatment? Do you have like new metabolic health issues, meaning like, did you gain or lose significant amounts of weight from your treatment? Do you have new peripheral neuropathy from your treatment? Do you have ongoing needs for your work experience, like transitioning, like the way, like you want to be part of the workforce, and yet how you might be part of the workforce is different than how you were before you were diagnosed? Do you have pain with intercourse? All these like long-term kind of whole person health issues that really matter for your day-to-day life, that you might not need specialty care from your oncologist. So that is something that a primary care clinician who is versed in providing care for people that have gone through cancer could do for you, could help you kind of have better quality of life and keep an eye on all these issues over a long period of time. Because there tends to be this, like, once you get through a certain time period from the end of treatment, okay, you're good now from oncology. And then people are like, what? I'm terrified. And now I have to go and talk to somebody who doesn't really know anything about these things or may not know. And so it's really important to interview a primary care clinician whenever you connect with them and specifically ask, do you have experience caring for people that are going through cancer? Do you have interest? Like, is this a passion of yours? Are you connected with other services that cancer survivors could benefit from if you're not at a big cancer center?
Mm-hmm. I think the other thing that patients benefit from is preventative care and well care. So yes, you know, cancer survivors will have these specific needs, late effects. How do you manage those late effects? But also just well care that we should be receiving as adults. And certainly the specialty services are not keeping up with that. So immunizations, other types of cancer screening that you should be having regularly according to the recommendations. And so, you know, that person can really, you know, bring in that piece that's so important.
Mm-hmm. Yeah, absolutely. And I noticed in talking to a lot of people during the session and outside of the session regarding primary care is people can seem to be on all ends of the spectrum, right? All points of it, whether they had primary care prior to cancer, maybe they had some difficulties during their diagnosis to where they might not want to go back to that primary care physician, or, you know, they've had that same primary care physician the whole time, or they didn't have one and then they decided to get one after their diagnosis. And I shared my story in the session that I had a really bad experience with my primary care doctor, and he laughed at me when I went in with concerns that I was gaining weight rapidly and I really shouldn't have been, and I already had low white blood cells, so I'm like, clearly there's already a problem, but you know, you won't listen to me. And I never went back to him. And so for 7 years I didn't have a primary care, and I used my oncologist as my default primary care. But at the same time, I felt like I couldn't go to him for little things. I couldn't go to him if I had the flu or if I injured my ankle or something like that. And it took, frankly, talking to you, Sam, that encouraged me to finally just look for a primary care physician. Now, how could somebody find a primary care physician if they have no idea where to start?
So one of the things that I recommend is that patients talk to friends, that they talk to other, especially like at these kinds of settings. Patients are here from all over, but if you are in a certain city, find out who your friends see as a primary care provider. And to find out a little of the backstory, like what is their bedside manner like, just sort of like you would ask about any other specialist. They're a really great clinician. Maybe you just need to know that they're super direct. They don't have the same, they have a dry sense of humor. So that way it sort of helps to filter some of those, what can I live with? I always tell patients you can't have it all.
Yes.
And so what are the things that, are must-haves, and what are the things that you're like, okay, I can work around that. And so find out who your family members go to, who do your friends go to that, they really like. Who do your fellow cancer survivors see as a primary care? And, do they feel heard by them? Is it, do they have to wait months to get in to be seen by them? All of those kinds of questions I think are important. If people are part of support groups, putting that question out there as well. To see, who is seeing these patients and what the experiences are.
Yeah, I think a huge part of this is in the beginning, you don't know what you don't know. So, I think conversations like this raise an awareness to what are even the questions to ask. And so you do have to do a little bit of legwork, especially because survivorship or onco-PCPs, they're in their infancy right now. This will be a medical specialty in the next 5-10 years, but we're not there yet. So in the meantime, you might have to ask your oncologist. Do you have any recommendations about clinicians who are comfortable caring for cancer survivors in the primary care setting? Or I would even say that some social media outlets, like some really good patient advocacy groups, are a great way to find out about where, what type of survivorship clinicians are out there. Organizations like LLS, like Cancer Survivorship Provider Network, like National Coalition of Cancer Survivorship, like even just knowing the term survivorship is huge. And I say this in the How Do I video that I made for LLS. Even if you don't like the word survivor or thriver, the word survivorship is important to know because it encodes this field of medicine that is evolving right now. So if you just know the word survivorship and then you can Google that, you can look up survivorship clinician or survivorship PCP or onco PCP, and then that's a searchable term that you can use to advocate and then start doing the legwork of who's accepting new patients and what will my insurance take and things like that. But other healthcare systems might have, survivorship clinicians as well. And I love what you said about preventive care, vaccinations, healthcare screenings. I think in the line of like knowing what we don't know, we're still learning about in somebody who's had whole body radiation as part of their treatment, like, is it appropriate just to do annual stool testing for colorectal cancer screening? Or should that person, once they reach the age of colorectal cancer screening, should they be having a colonoscopy? We don't know. We're still studying survivorship populations. And so I think that it's important to understand where we're at in this kind of field right now so that you can know how to advocate for yourself.
Yeah, absolutely. I think advocating for yourself is so, so important, particularly for young adults with cancer. And you mentioned a lot of different ways. And for me, I just went to my oncologist and I said, hey, I'm ready to go to primary care. Could you refer me? And I used her suggestion and looked for somebody in internal medicine. And so he referred me right over. She saw me for 2 hours on my first visit. It was wonderful. And now I just feel so encouraged that I can go and call for anything and really feel established somewhere and can get to build a relationship with somebody who knows me and knows my situation, where I don't have to continually bring up things again and again like you would say if you went to urgent care all the time. One thing I want to bring up, and we're also recording a podcast this weekend, and I spoke to somebody on the podcast who lives in an area where it's, even if you're established with a primary care physician, it's really hard to get in. And she was talking about it can be months out to even be able to get in, for a cold or for something like that. And so they kind of just go to urgent care, even though they have a primary care physician. What would you say to patients like that live in those areas?
Well, I think virtual care is a really big up and coming thing. Even in my practice, I'm a hybrid clinician, so I have in-person days and then I have telehealth days. So that might be an option for patients living in more rural settings, like looking for telehealth practices. And I think that that's even kind of a developing skill in medicine, is being able to initially screen and advise somebody over telehealth, and then being able to recognize, like, no, you really need to be seen in person for this issue. But that might be one kind of workaround for people living in a rural area with limited access to this kind of care.
Well, thank you both so much for joining us today. We really appreciate you. I think that this was such an amazing session that we talked about, and I hope that we encouraged all the young adults and everybody listening to really look into having a primary care physician and understanding the real benefits of that. And so again, thank you both so very much. Be sure to tune into our next Hematology Horizons episode, and also check out our How Do I video that features Dr. Siegel here talking all about survivorship care. So you can go and get more information right in that video. But again, thank you all for joining us, and thank you again to our guests.
Thank you.